Hello learners, welcome to Neenv IAS. My name is Kshitij and we are continuing with our science and technology previous year questions for CSE mains. So the topic today in this lecture is health tech. Topic is health tech, right? So let us see the question. The question we are going to discuss is from 2020. The question says the COVID-19 pandemic has caused unprecedented devastation worldwide. However, technological advancements are being availed readily to win over the crisis. Give an account of how technology was sought to aid the management of pandemic, right? So it is asking the technological role. Although the question was expected on COVID, was because obviously it was a huge event in our history, but then again they have made it very specific towards technology and how it was used to control, that is the management of the pandemic, right? So let us understand the question. See, it was expected, like I said, focus more on the Indian application, right? Because the examiner would relate more to the Indian scenario, obviously. And of course, if you have some special international example, you can use that also. Next, this is a broad question. So remember to include non-medical application of technology also. Don't become specific towards the vaccination one, because students have a habit of specializing the answer, because they would think that this is focusing on the vaccine development and the process and the dissemination of the vaccine. No, other things are also there, as we will see. So the blueprint will be in the introduction. You can simply highlight how it was unprecedented. In the body, you have to again discuss the technologies, of course, new one and the existing one. Remember, like this, new one also and existing. Next, in the conclusion, of course, you have to suggest something if you can. Then how technology can further aid in managing similar crises in the future. So let us see the answer. In the introduction, you can talk about the disruption that was caused because of COVID. It affected everybody on the planet, every human life. So disruption was there in lives. Literally, lives were destroyed, companies were destroyed. Many people could not recover financially from this pandemic, right? Countries were affected so much that their GDP fell by at least 5 to 10%. Then healthcare systems were overwhelmed. Many doctors, nurses, they were affected by the infection because they were treating them, right? So technology was a key ally in managing all these things, right? So technology helped societies to adapt, respond, and recover. So this is a good keyword that you can remember: adapt, respond, and recover. I hope this is visible. Okay, let it be. Right. So what are the interventions? We come to the main body part. What are the interventions that were done, right? So the first thing was digital contact tracing. Why this was important? Because we had to stop the infection from spreading. So let's say you got infected or I got infected. Now the people who were close to you, they would be informed, but by using the applications. So new software were created which could track your location and location of people nearby you, right? So let's say you got diagnosed and in your application it would be updated. Now people who would let's say who were in close proximity of you in the past 7 days, they would be notified, right? So all these things were used to notify people that you have been in contact with the infected person. So examples like Arogya Setu, Trace Together in Singapore. Saudi Arabia had many apps like Seha, right? Tawakkalna, Taboud. I might have messed up the pronunciation, but yeah. So these particular examples were there. Now they used GPS, Bluetooth to identify the contacts of the infected individual, like I just mentioned. All right. So this was the use, right? Now next comes telemedicine. Of course, infectious diseases will spread from human to human contact. Now doctors and medical health workers are very vulnerable to such infections. So how to reduce that? Of course, they need to protect themselves, so they will use telemedicine. But on the other side, the patient will also be benefited because they will not be needed to go to the hospital, and there would be a risk of contracting some other disease also because their immunity is weak. So both are getting benefited, the patient and the doctor. So telemedicine adoption was accelerated during the COVID times, and this was proved by a study which was done by Stanford Healthcare, that around 70% virtual consultations were increased. That means earlier if it was 2%, they increased to 70%, right? That's a huge jump. So various platforms came up, and some were there earlier also. Like I mentioned in the introduction, existing technologies should also be mentioned. So Practo, Apollo 24/7, Teladoc in USA, right? Teladoc, right? Next is remote work and education. Many tools were created, especially Zoom was really famous in that area, and it was one of the most profitable digital technology that were created. Microsoft Teams is there, and there are a lot of educational platforms that gave online education so as to stop the disruption in the course of the students, right? So this was basically what it led to was continuity in work and education, of course, and this was rapidly implemented because there was no other way. So due to COVID, digital adoption rose almost to double. Many people who were not, let's say, accepting the online way of working, they had to go and work. This applies to both employees also and employers. McKinsey gave a report that said companies implemented remote working solution 40 times faster than expected. So it's not like the thing was not going to happen. There were a lot of companies who were adopting work from home policies, but due to COVID, this was done at an unprecedented accelerated rate. Let's move on to the next point in this, AI in drug discovery. So Google's DeepMind was used to predict the virus structure, right? Then there is a company called Infravision. Infravision, it gave or it produced a software for scanning the lungs for infection, or let's say the scan of lung was using AI. The scans of lungs were judged if they had some lung infection, right? So basically AI was used to scan a lot of the medical images, and then they try to diagnose who or who might not be infected. So what happened was vaccine development was also accelerated because AI was used to predict the structure of the virus. Next is robotic assistance. You can see the image here. This is the Mitra robot, right? It was developed in India for hospital usages, right? It used to go regularly, meet patients, and basically provide a support, because infection needs to be stopped from spreading even to the health workers. So robots were used in sanitization, delivery, supplied, let's say medical supplies were transferred from one department to another via robots. Then patient care, like I just said, they used to go and interact with patients, right? So Mitra robot was used in Indian hospitals. Next is the development of vaccine. Now everything that was available was used for this. For example, the biotechnology, the supercomputers, right? The artificial intelligence technology, machine learning algorithms, everything that was at disposal was used. Things like genetic engineering, mRNA technology. The world developed a lot of vaccines in such a quick, let's say, pace, because already a lot of development was done in the mRNA department, because of which we could develop the vaccine quickly, and there were a lot of trials, vaccine trials that are going on simultaneously. So AI was used to find the structure, and then also to, let's say, find out the side effects. Now, what about vaccine distribution? Many people forget this, right? So CoWIN platform that was used for registration and real-time tracking of the application and patients, right? Let's move ahead. Big data and AI. Although AI I've already mentioned, but big data, if I mention, it would be incomplete without mentioning AI. So in relation to big data analytics, I'm mentioning AI over here. So big data analytics was used for assessing the risk of a population contracting the virus, right? So risk assessment was there. Modeling was done using machine learning algorithms. Modeling means they were trying to predict which country might have more chances of having infected clusters of people, right? People who are infected, their group, and they try to identify where this group might be, let's say, present more, or where are the chances of this happening, right? In India also, AI enabled MyGov platform was there, right? So machine learning algorithm was used to predict the second and third wave. Next is virtual biometrics. Now this is a very interesting thing because sensors were placed at airports, railways to track people's temperature. All right. So facial and iris recognition with infrared, because let me read it first. Thermometers for screening. Infrared measures the heat that is radiating from a body. So that radiation was tracked, and at many airports and railway stations, biometrics were used, right? Work from home. Now technologies like 4G, 5G, and of course a smartphone and internet, let's say broadband, these were used to work from home, right? Like I previously mentioned, that was more in the context of education. This is more in the context of work from home. So you can combine those points or you can write them separately. Next is virus detection. Now CRISPR test, that was, or let's say RT-PCR test to be more precise. RT-PCR test is the result of biotechnology. Now this technology was used in testing of the diagnosing of the virus. Let's say if you have an infection, RT-PCR test was done, right? So Tata CRISPR test was the first one in India which had the or which gave us the power to detect and diagnose the COVID-19 infection, right? Next, cost effectiveness. It's sort of a general rule that when you use technology, you have large scope of reducing the cost of your operations. Operation in the sense the functioning of the organization. So similarly over here, digital technology was used to reduce the burden on the patient to get the cure and burden on the hospital to reduce the cost of dissemination the cure. All right. And there was a study in Taiwan and it was proved that this has actually happened. All right. So in Taiwan, there was a study done on this, that it has actually reduced the, let's say the cure, finding the cure, and the cost for the patient and the doctor has reduced because of adoption of digital technologies. Now next section, right? So many people would finish off the answer here and just describe these things and then conclude. But then again, I wish my students to have some edge over other students. Now for that, I'll work hard for you, don't worry, right? So I have brought you a section of information which you can write just in brief. You don't need to actually write in a very long manner like I've done, because what happens is you read 8 points but you remember 6 points, and then in exam pressure you write 4 points and even less than that. So the point you need to note is, for a wholesome answer, you need to write something else also, which is barriers to the digital health technology adoption, or you can say barriers to adoption of health technology, digital health technology, right? So what can be done? We can just simply read these because these are self-explanatory. Wherever required, I'll explain. So the first thing is, there is lack of infrastructure like internet, electricity. Then there are challenges in belief and perceptions about digital health. This is very important because a lot of people don't trust the digital technology. Many people I know right now, they have a distrust of even banking apps, so they go to the bank itself to do the stuff, right? Next is issues with internet connections, digital health support, data security, privacy. These are very important, which obviously you would be knowing if you are trying to understand this answer, that there are privacy concerns. There is support issue also. That means people will sell you the product, but they will not provide you service when something goes wrong. Economic status is also a barrier because many people are not able to afford smartphones also. So what about them? And India has large proportion of those people, such people, right? Next is rapid shift to digital health, right? increases financial pressure. Now this financial pressure falls both on the government and on the patient. Next, short implementation period led to lack of proper guidelines. Now because of which in Middle East, in sub-Saharan countries, because of the lack of guidelines, there were a lot of data theft of the users. So how do we conclude? See, you have to basically connect with the future, because although the pandemic is going on, this has provided us lessons for the future. So you can say it has demonstrated that the critical role of technology is basically helps in public safety. You can say the COVID-19 pandemic has demonstrated the critical role of technology in crisis management, from healthcare delivery to vaccine and public safety. Now, as the world continues to combat this pandemic, the ongoing integration of technology in public health strategies highlights its importance, and in not only addressing the current but also in preparing for the future pandemic. So this is important, that somehow you summarize the answer in 2-3 lines in different words. Now you don't have to write such a big conclusion. All these things are model answers, so you can obviously skip some things which you don't feel right, and of course you can input your own things also. You have the power of internet, right? So the main thing is, what I wanted to tell was to link with future pandemics, because it has given us the lessons, correct? Now I have some value addition for you for this answer, right? Now many times what happens is you don't have enough content, so value addition will help you there. So the first thing is, you need to read about some keywords: health informatics, health economy, and what is the ACT accelerator. Please read about these 3 things, because they are related to this, and indirectly you can write about them in any health related technology answer. Okay. Next is the structure. Now I've bought another structure for you. There was one structure which I followed. Next, what you can do is, if you want to differentiate yourself, you can divide the points that I gave in 3 types. Reducing the transmission, the technology which helped in reducing transmission. Second, in searching the cure. Third, handling the effect on the world. So in these three ways, you can also divide the answer as required, okay, depending on your own creativity level. So my point is to give you another idea of how you can develop things, because here at Neenv we try to give you something different. Now another thing which I wanted to share is determinants of digital health implementations. Now this you can put up in any way, right? You can change the phrases and you can put up this in any digital health or digital technology adoption. So the first thing is, ease of access to technology is very important. Many old people are not able to use the current technology. They need, let's say, if they have eyesight problems, they need mobile which has bigger text. All right. Next is individualized digital health platforms to meet users' need, like Practo. Next, secure digital health platforms, of course, because of data privacy. Next, well-trained human support. Now I have mentioned a point about support previously in challenges. Now this thing is important, because people forget to write this. All right. Okay. So that is all for this question. Thank you.